my name is Bethany and I make videos about Charcot-Marie-Tooth disease. And last week I had posted a video about the funny way I found out the NHS had deemed me extremely vulnerable to the coronavirus. And after that video, a few of you asked me what information I've been given about CMT and the coronavirus here in the UK. There actually happens to be a CMT clinic right here in London, and a couple of the experts there have prepared some information that they sent all of their patients. I'm going to link you to all of that information in the video description, but I also am just going to give you the gist here. For most patients with CMT, your risk is the same as the general public. However, there are some people with CMT who have additional complications and are potentially at an increased risk. Now, the wording in the materials for this was a little bit confusing, so I'm popping up the actual wording for you just to see yourself. But my understanding of this is that if you have kyphoscoliosis or diaphragm weakness or vocal cord paralysis, or you use a CPAP or NIV to sleep, all of those may be additional risk factors for coronavirus. They also mentioned that patients with CMT may have additional medical problems that may put them at increased risk. And they didn't mention any in particular, but at this point it looks like obesity and diabetes are both major risk factors with the coronavirus. And I could see both of those risk factors being more common in our community, not because CMT causes them, but because we tend to be less mobile, and that can put us at risk for additional health issues that then may increase our risk with the coronavirus. One document they also linked to was prepared by the Association of British Neurologists, and it's this giant chart of all these different nerve and muscle diseases, and for each one they list what they believe to be the risk with COVID-19. And they list either the risk as low, moderate, or high. And for basically all of the diseases, it'll say like low/moderate or moderate/high or high, except for the inherited neuropathies, which is of course what CMT falls under, which are listed as none/high, which is like a really interesting range. And in the detailed comments, it says that there is no increased risk for uncomplicated Charcot-Marie-Tooth disease. I don't know what is uncomplicated Charcot-Marie-Tooth disease, but I guess they mean just sort of your run-of-the-mill CMT case that is mild and doesn't have any additional complications, especially with breathing. However, it does say that patients with kyphoscoliosis or diaphragm weakness may be at a high risk. Here's the thing. We don't really know. There haven't been any research studies on coronavirus and CMT. This is still a really new disease, and all of these experts are just trying their best to create recommendations for something that we don't yet fully understand. Granted, they are making these recommendations based on their decades of experience, and I am incredibly grateful to them for putting this info together. As for the reason I was given an extremely vulnerable designation, that is because I already had an existing secondary diagnosis for restrictive lung disease, which was caused by my CMT. And I should emphasize that that is rare, especially at my age, but it can happen. And that's why I'm going to start creating more videos about it and about breathing-related weakness from CMT. If you would like to see those videos, please click subscribe. Thank you so much for watching, and I hope you are safe and well out there.